Well, good morning and happy Aloha Friday. I'm Ryan Kalei-Suji, joined by Yanji Denise. Thanks so much for tuning in here to Spotlight Hawaii on the platforms of the Honolulu Star-Advertiser. Today, Yanji, we have a special guest and a lot to get to.
That's right. We have Governor David Ige live from his office at the state capitol. It's rare that we get you on a Friday. We are so happy to have you here with us. You made a lot of big announcements yesterday. July 8th is now the target date. Tell us about what went into your thinking and how you're feeling about the rate of vaccinations right now.
Yeah, thank you so much, Yanji and Ryan, and thanks once again for giving me this opportunity. I was just thinking about that. I think this is the first time we've done it on a Friday, so it's great to be with you. We have been talking with the mayors for the last 4 weeks at least, just about how to incorporate vaccination rates. What the vaccination rates means to our controlling the virus. And we all agreed that at 60%, we would be willing to relax restrictions. And the other thing that we talked about is we know that these changes are significant and that our businesses and organizations really need to prepare for these changes. And we need to advance notice, let people know ahead of the actual date. Because they need to plan, they need to adjust work schedules and a whole bunch of other things that are so important to being successful. And that's why we really felt compelled yesterday to announce it's 2 weeks out. Our projections show that we should be at 60% of our community fully vaccinated around July 8th. And that's why we set that as a target date. And people have asked, we're going to do it on the 8th. We expect that we would get to 60%, plus a day or so, or plus or minus a day or so. And we know that for our community, it's very important that we have a specific target.
And so again, just to clarify, regardless of, maybe say the state gets to 59% and it's not that 60% on the 8th, regardless of where we're at, that deadline is firm and July 8th is the date where this will all take place.
Yes, that's correct, Ryan. And the mayors will be issuing modifications to their existing orders targeted at the changes on July 8th.
Of course, the next big hurdle will be getting to that 70% threshold. How long do you think it will take to get us there? And also, a lot of other states, when we're looking at their percentages, they're only using their eligible population when they're making their calculations in terms of percentages and reopening. California, for instance, Vermont, New York. Why have you decided to continue to keep the 12 and under in our total population when you're trying to reach these benchmarks? And also, how long will it take to get us there?
Yeah, just a couple things about that, Yanji. Just in speaking with Dr. Char and Dr. Kemble, they really felt that it was important to continue to remind everyone that it is about the total population and everyone in our community is susceptible to getting infected with the virus. And just because we make progress in one specific segment doesn't mean that our community is protected. We want to be able to protect the entire community, even those not eligible. When you look at who is not eligible, it's really children 11 and under. In many ways, they're the most precious of those in our community, and we all are trying to protect them. We felt that focusing on eligible would give people the false impression that it's safe to be out and about and that we can drop the restrictions. We just want to remind everyone that it is the total population that is important when we talk about herd immunity. And we want to continue to remind people that we have work to be done.
We want to bring in a question here. Ryan is asking, is there a cutoff date of fully opening up in the event that we do not reach the 70% fully vaccinated? Are you considering any modifications to that benchmark should the state not be able to obtain the 70%, say, by September or October? I mean, is there flexibility, I guess, in that benchmark that you set?
Yeah, Brian, there is flexibility in the sense that we are looking at all of the health indicators, besides the number of new cases and hospitalizations and really IUC beds under use. We do monitor all of those things. there's a couple things that we know. Vaccinations have been very effective. Most of the cases that you see, the overwhelming majority are people being infected by COVID they're not vaccinated. We are seeing very, very, very few individuals who got vaccinated, fully vaccinated 2 weeks after the second dose, and getting COVID. So I think that that's really important for everyone in our community to realize. And there are a couple of new variants that can be scary because they are much, much easier to transmit, and people, although the science is not conclusive at this point in time, we do know that it seems like people are in the hospital a little more frequently, even if we're not certain about whether more people will die from the virus at this point.
At the current rate of vaccinations, when do you think we will reach that 70%?
Yanji, one of the things that we are concerned is that the pace of vaccinations has really dropped significantly. In the month of May, we averaged about 72,000 doses administered each week. In the first couple of weeks of June, that's dropped by 50%. We are now averaging about 35,000 or 36,000 doses a week. And that's a big concern. A lot of our projections kind of try to assume that the rate of vaccinations would continue. We see those significant declines. So I know that people want to know when we project to hit 70%. It's really hard to make that prediction because the pace of vaccinations have really fallen off.
So if we look at things, okay, so July 8th, right, we are going to be changing again the Safe Travels program, where those coming in from the mainland can then now upload their vaccination cards to bypass the quarantine period, and then say when the state is ready to get to the 70%, all of that will be lifted, and there will essentially be no Safe Travels program anymore. What was the thought process into going to that? Because there are some out there who say it's okay for us to maybe lift the restrictions here locally, but that maybe we should continue to keep Safe Travels in place to make sure that those entering the state still show some sort of verification of a vaccine. Can you talk to us a little bit about that whole process, about maybe doing away with the Safe Travels program when we get to that 70%?
Yeah, certainly. And Ryan, I know you asked me earlier, is there some other trigger that we are looking at? We have been talking about at what level would we believe that that the virus activity is low enough that it doesn't pose a health risk to our community. The Delta variant has Dr. Char and Dr. Kemble is very concerned, just because I don't know if you've seen some of the stories. Dr. Fauci has said that the Delta variant is growing exponentially about every 2 weeks. So about every 2 weeks, the number of cases have been doubling. We have had confirmed Delta variant cases in our community now. And they occurred in some people who did not travel at all, which tells us that it's circulating in our community. So I do think that that variant is a concern to ours. We're trying to manage it. The good news is we do know that even within the household where those were infected with the Delta variant, the other members in the household were vaccinated, and the variant did not spread within that household. So we know that the vaccines are very effective against the Delta variant and all variants that have been identified in the United States to this point in time. And that's why we keep pushing everyone get vaccinated, because we know it makes a difference. It reduces the seriousness of the illness, and it does protect us from spreading the variant around in our community. So we don't have a hard number, Ryan. We talk about it all the time. I have asked Dr. Char and Kemble to really focus in on that and try and determine some level so we can share it with the community. But we just haven't gotten to consensus at this point in time.
There are a number of questions in here about when we get to July 8th and vaccine verification for folks who are from the mainland. Obviously, it's easy for the state to do it with local residents because the database is right there. But there are some people who are wondering what you're doing to make sure that people aren't uploading just, Xerox pieces of paper.
Yeah, so we will be utilizing the Safe Travels program, and we're asking those beginning July 8th to update their vaccination record. And we are asking those screening for flights to verify, make sure that the name is the same as those who are flying, that the vaccination date has occurred within more than 2 weeks from the flight to ensure that they're fully vaccinated. We won't be able to verify it against the databases of other states yet. We continue to work with a couple of vendors that have access to the other states' verification records. And, we continue to move forward, Yanji, and hope that we can get that verification in place before July 8th. But we felt that it was important for us to be able to specify a date, even though we may not be able to verify all of the mainland vaccinations at this time.
We know that, with this announcement, there is an expected surge. Again, this is the summer months and tourism numbers are continuing to go up. And with this new process that is in place on the 8th, tourism officials are expecting an even larger amount of tourists that are coming in. We spoke to Mayor Daryl Kawakami the other day here on this program, and he said, look, I'm not in any rush to get this program going because we're already, pretty maxed out right now where we're at. Are you worried about the potential surge of visitors that could be arriving here and the state's overall infrastructure? We're seeing some of those longer lines at the airports. Of course, the rental car facilities continue to be backlogged because of those issues there. What are your thoughts, and how do you think the state can help to prepare for what could potentially be a large summer surge of visitors?
Ryan, we have been working with the hospitality industry, the rental cars, the hotels, the restaurants in general, to try and get them prepared for these changes. We want to get people back to work at the hotels, at the restaurants. We continue to work with the rental car companies, to get them to hire and expand their fleets, because we do know that travel is overwhelming. We've been working with our travel partners, the airlines, to really let people know about some of these challenges that we're seeing, lack of rental cars and those things, and really encouraging all of the travelers to get reservations and ensure that they are fully aware, for example, if they can or cannot get a rental car when they're here on their vacation, so that they don't come to Hawaii and is surprised by their inability to get a rental car. I think that we're getting better every day, working with the various companies. It's not going to be perfect. We know that, but we want to ensure, and everyone in the industry is really committed to ensuring that those who come to the islands still have an experience that they enjoy, and that they're willing to talk to others and encourage others to travel here. It's a huge challenge, but we are making progress.
You talked about that pace of vaccinations falling significantly from May to now. I'm curious to know, do you think the incentive program that the state created, the High Got Vaccinated, do you think it's having any impact, or should there be, should you essentially level up? Would it be worth it to do $1 million lottery like some other states have done? Or is there something else you're looking to? Because it does not seem at this point that that's really gotten the results that you wanted.
Well, we are seeing, Yanji, we were monitoring the pace of vaccinations prior to us launching the High Got Vaccinated program. And, we estimate that it's boosted vaccinations by about 10,000 per week since we started the program. So, we already saw the decline. It was the number of vaccinations were declining pretty aggressively. And the program has added about 10,000 new vaccinations per week. So we are coming to the end of it. Want to encourage everyone, if you haven't got vaccinated, even one dose will qualify you for the drawing. All of those prizes that are up for grabs in July will be distributed and selected. So everyone, if you have already been vaccinated, go to igotvaccinated.com and register for the drawings. We want to encourage, and those who have not been vaccinated, please, you have a couple days more to ensure that you can get into the drawing. There's free round trips, miles for airlines, and hotel points, which can result in a real good staycation or vacation for those of you who are vaccinated and are fortunate enough to be drawn.
I want to switch gears a little here. Earlier this week, you submitted and presented your intent to veto list, which included a number of bills on there. Some in the legislature were shocked by the amount of bills. And we know that in your press conference, you mentioned that some of those that you vetoed had to do with guidance that you got from the federal government, as well as what is allowed under the support that they are providing through federal relief. And there are other bills, like the bill that would cut funding to the Hawaii Tourism Authority. That was one of those bills as well. Can you talk us through, I mean, I know that there were a number of them, and maybe you don't have to go through all of them, but if you can talk through some of your thought process about the vetoes that you have listed on that intent to veto list, and are you concerned at all that the legislature might head into this special session to override that?
Yeah, Ryan, certainly I do think that the legislature will review the reasons that we had in adding bills to the veto list. And I'm certain they'll look at and make a decision about whether they want to override. In the case of House Bill 862, which dealt with the Hawaii Tourism Authority, we really feel that dedicated funding for the Tourism Authority is very, very important. I mean, all of us know that our community wants to deal with visitors differently, and we want the ability to manage those who are coming. And we do want to get to fewer visitors, but those visitors who would spend more, be respectful of our environment and our culture, and really end up with that win-win situation. Well, House Bill 862 would devastate the Tourism Authority and would mean that there wouldn't be anybody that would be managing tourism in a way that can be successful. It also authorized increase in the TAT, which would be a 30% increase if all the counties enabled that 3% maximum. And it actually took away what we're already sharing with the counties. It deleted the state's commitment to more than $100 million to the counties to support police, fire, ambulance services, lifeguard services at many of the beaches. So, I was very much concerned with the unintended consequences of that measure, and that's why it got on the veto list. There are a couple others that we got guidance after the legislature concluded that said that the appropriations were not appropriate. So that's House Bill 613, which dealt with spending or establishing a spending plan for rescue and relief funds for the Department of Education. Clearly, if we do not comply with the federal guidance, we could lose $600 million that the public school received. And the state got $1.6 billion to really help us through this budget crisis. The third condition that I think changed since the legislature concluded is, our economic recovery is going better. We're seeing increase in revenues. The Council on Revenues upgraded the forecast in May, and they added $3 billion to the 7-year forecast window. So significant, hundreds of millions of dollars more in general funds that will be available. So some of the tough decisions that the legislature made, like taking away the TAT from the counties, they repealed a couple of special funds and trust funds to get money to the general fund. I think that those drastic actions may not be required because the economy is improving. And those are some of the measures that were also on the veto list.
You know, Dave Hull has a question. This is not about your vetoes, but it's about some of the COVID restrictions that are in place. We know that it's at July 8th. Obviously, things are opening up to much larger degree. But he says, how can restaurants go to 75% and have to keep 6-foot distance? One of the issues that a lot of restaurants face is that their spaces are small, and Hawaii real estate's expensive, and a lot of restaurants are tiny. So even if you allow, capacities to increase, they can't necessarily do so because they have to, keep that 6 feet distance. Do you think that that 6 feet distance should be reduced down to 3 feet as it has been in some educational settings?
Yeah, Yunji, we are definitely working through those, those areas that the guidance might be conflicting. We still continue to see the virus spread in restaurant situations, and that is the public health concern. But I've also heard from many restaurants that it's difficult for them to work out economically at the reduced capacity levels. So, I know that Dr. Char is working, Mayor Blangiardi is really wanting to relax restrictions, and we want to get to a place that we can safely allow businesses to operate, at the same time slow the spread of the virus. So, one of the reasons for announcing the target as July 8th, it does give us a couple of weeks to kind of work through those details. The Department of Health will be working with the counties about specific guidance and how we can reconcile and get more capacity in restaurants in a safe way.
Another thing that has transpired, of course, through the pandemic has been the federal support, including benefits for those who file unemployment. Wanted to ask you about the $300 plus up that is continuing to be offered to those who qualify for unemployment. There are some states that have gotten rid of that, and there has been some talk in other states about removing that to help the demand on the workforce overall within the different states. Your thoughts on kind of continuing that through? We know this goes through September. Has there been any other discussion about potentially removing that $300 plus up, or do you plan to continue to continue to offer that $300 to those that qualify?
Ryan, we are looking at, we do evaluate all of these policies and really try and make the best decision we can on behalf of the community. As you know, the cost of living in Hawaii is high, and there are many that are still unemployed that continue to struggle. And we know that for those hardest hit, it has made a significant difference in their quality of life. So, we continue to work with the employers. We've set up processes so that if employers are having difficulties hiring people, and if they're making job offers and that are being declined, especially to those who are on unemployment, we are following up and trying to get people back to work. So we will be evaluating that. We know it helps people right now. We know that more people are going back to work, and and we continue to work with the businesses to see if we can close the gap and make sure that every business can hire and offer jobs to those unemployed, and that they will be accepted if appropriate, and we can get everyone back to work.
There's a question here from Mike Ramsey. I think this might be better suited to the mayor, but he's asked it several times, so I want to get to it. He says he does consulting for an Oahu bar. They used to be able to close at 4. If they did vaccine verifications, he's saying, would you consider going from 2 to 4 a.m., to make sure that those who are vaccinated are in the bars, and that way they could have more shifts open for their workers. I think this is really a city question, but what are your thoughts on that?
Yeah, it is a city question, and we have been struggling about vaccination status. We don't want to create the notion of haves and have-nots, but we also are wanting to recognize and create incentives for people to get vaccinated. We know that if 75% of those in a customers in a business or workers in the business are vaccinated, that risk of infection is dramatically lower. So we have been working with the county trying to think through what appropriate relaxations could be if businesses were willing to ask and ensure that those customers coming are vaccinated. And that's really a fine balance, but we continue to look at ways at how we can work with businesses to get them to be more economically profitable and continue to keep customers safe.
We only have a few more minutes, but I did want to quickly get your thoughts on the interim superintendent, Keith Hayashi, who will be taking over for Dr. Christina Kishimoto, who will be leaving her seat coming soon. Want to get your thoughts on this appointment of this interim superintendent, and do you feel that he is someone that could potentially be nominated as the permanent replacement, and your experiences working with him thus far?
Yeah, thanks for that question, Ryan. As you may recall, 4 years ago when there was a change in the superintendent, Keith Hayashi actually was the interim superintendent for a period of time. And I still remember talking to him at that time about pursuing the permanent job. And he politely just told me that, he was committed to Waipahu High School, that they had initiated a number of programs that he really wanted to see through completion. So when he called me this time to let me know that he was applying for the interim superintendent, I was really excited to hear that news. I think everyone has seen what a remarkable job he's done at Waipahu High School. It has become one of the model schools. They're a leader in early college, which is a program that I think is so, challenging our students to complete college level work while they're still in high school. And his commitment to having every single student on that campus part of that early college program just really tells you a lot about Keith's expectations of students, his belief that the sky's the limit for every single one, and his focus on really student learning and student achievement is really what our superintendent needs and what the public school system needs. So I didn't have a chance to talk to him about whether he's pursuing the permanent position. I think it's great that he wanted to serve as interim superintendent. And I have every confidence that the Board of Education will find a terrific superintendent to lead our public school system. And I think most importantly, really build on the successes that we have had with Dr. Kishimoto here in our public school system.
We're already almost out of time, so just wanted to give you an opportunity for some final thoughts on this Friday. As you mentioned, just a few more days to get vaccinated and qualify for the High Got Vaccinated program. Just what your, if you could give us a final message on this Aloha Friday.
Sure, thanks, Yunji. Really want to encourage everyone, if you're not vaccinated, get your questions answered. We want you to make informed decisions, but I know that the vaccines are safe and effective. It really does prevent you from getting COVID, and it does prevent you, if in fact you get infected, from very serious illness, and that's a huge advantage. I certainly want to encourage everyone to get their questions answered and then get vaccinated. That's the best way for the entire state to get back to the new normal and really allow us to get everyone back to work and everyone back to normal, meaning schools get started and businesses begin hiring again to get our people moving. So just wanted to thank Ryan and Yanji for giving me this opportunity. Really wanted to thank the people of Hawaii for investing in our community and getting vaccinated. Please encourage your friends and neighbors to do the same.
All right, Governor David Ige, thank you so much for joining us here on this Aloha Friday. Have a great weekend, and we'll see you soon.
Yeah, aloha.
Aloha. Always interesting to hear from the governor there. We covered a lot of topics. Of course, vaccinations are top of mind right now. They did announce yesterday that July 8th deadline, or date rather, for lifting a lot of the restrictions, because it's estimated that we will get to 60%. But Ryan, you heard him say there, he doesn't want to give a date for 70% because it really doesn't sound like they know when they're going to get there given the pace right now.
Yeah, and they're going to continue to push that vaccination progress. That there is, though, talk, and he mentioned that they are looking at other metrics to determine whether or not the 70% is going to be the definite date that, or time, I should say, when all those restrictions are lifted, that they are going to continue to look at hospitalizations, look at the infection rates in the community. He is concerned about the Delta variant and its presence here. We know that there have been a number of cases already that have tested positive for that variant and the impact that it could have quickly on this community. And so he's not necessarily saying that we are going to be hitting that 70% anytime soon. He knows that it's going to be a process, but at the same time, there may be some flexibility in that initial benchmark that had been set.
Yeah, and also interesting to hear his answer to the question on restaurants and whether he would consider maybe changing some of the restrictions so that you wouldn't have to be 6 feet apart. They're looking at that. Also looking at vaccine verification for private businesses. Is there a way for certain businesses to maybe have fewer restrictions on what happens inside their business if they can do vaccine verification? You know, a lot of these questions, of course, or decisions rather, are being made in tandem with the Department of Health and Dr. Libby Char. We are fortunate that we're going to have her as a guest on Wednesday, so we will ask her a lot of these questions. We do hope that you in the audience who have posed those questions will join us again then, because it's always a great opportunity to talk to the director of the Department of Health.
Yeah, a lot of great information provided here this morning. We thank the governor for joining us once again. We thank you for tuning in and for your questions. We'll see you right back here on Monday for another Spotlight Hawaii. Have a great weekend.